welcome to the webinar today. Today this is being delivered by the Wellbeing Line, and this should only be about 30 minutes. So please take the opportunity now to pause the webinar, to get comfortable, grab a hot drink if you need it, and we'll just introduce ourselves. So my name is Rebecca Paris. I'm a clinical psychologist with the Wellbeing Line.
And my name is Martina Halmadi, and I'm a counselling psychologist with the Wellbeing Line.
And we'll be taking you through thinking about some of the emotional costs for us working in health and social care, specifically the topic of secondary trauma. This is only going to be an overview, as we can only cover so much in a mini webinar. But if you're interested and want to find out more, please contact us. Our contact details are on the slide at the end, or you can have a look at our website. So nothing is intended to be difficult or triggering in today's webinar, but we will be talking about mental health and trauma. This is not intended to be a therapy session, but we will be thinking about the emotional impact of the work in general terms. So we encourage you to look after yourself, and if you need to pause the webinar or step out for a moment, please do so. So why do we need to think about our mental health? Well, we're all human, and experiencing distress at times is an aspect of being human. We know that stress can build up gradually. We all have a capacity or reserve within us to deal with stress, and we can liken this to a bucket. This collects stress and things that have happened to us throughout our lifetime. So things that might have happened in our early life through things that are happening more recently. So it can be about our long-term health, finances, our work, our family, our relationships more general can all sit in this bucket. As these things fill our bucket, we get closer to the top. And especially if we're not able to manage them or cope with them or deal with them directly in the moment. As we get closer to the top, we might feel like as the new stress comes in, we might feel like we're being a bit more overwhelmed more quickly. We might feel like we're firefighting situations because our lives are full of daily hassles, things that happen. We might lose our car keys, the car breaks down, the dog is sick on the carpet, whatever it is. And as we get closer to the top of the bucket, we might feel that we're getting a bit more overwhelmed quickly. When our buckets fill up and they get to the top, we might experience an overflow. And when we experience that overflow, what we might notice is that we might be more irritable, short-tempered, we might notice a bit more anxiety and worry, or we might be more prone to low mood and feeling a bit more negative. So as we know that this can build up gradually, it's really important to bring awareness to this and find ways that we can release some of that stress. So as you can see on the image here, you've got a tap, and it's how do we do that? How do we release some of this stress? We know that everyone has a different capacity for managing stress and will experience stress differently. Often people will carry these stresses in the bucket and we don't know about it. So it's really important to recognise that actually we don't know what's going on for everyone. We don't know how full everyone's bucket is. So talking about mental health provides an opportunity to understand what the stresses might be, how they might be impacting on someone, and how we can support them or signpost them to the support they might need. Also, by recognising how full our own buckets are, we can then recognise when we need to perhaps look after our mental health or think about when we need to reach out for support. We know that when we're looking after others, when we're caring for other people, it requires an emotional energy from us. Stepping into someone's distress can cause us to feel more emotionally overwhelmed at times. This is a really important part of our job, but we know that we need to look after ourselves as there can be a cost to caring for other people. We know that there are lots of things that we can do to manage our mental health and recognise when the stress is building up, but we also need to recognise that our jobs are set in a context, that we might be doing all the things that we need to do to look after our mental health, but there might be other things that are slightly more out of our control that will be impacting on us. So, for example, we might notice that our relationships at work are having an impact. So do I have a good relationship with my line manager? Am I experiencing bullying, racism, or discrimination? Are myself and my colleagues treating each other with civility and respect? Because that can all have an impact. We need to recognise that sometimes there is an impact due to the workforce. There might not be enough staff. There might be vacancies or sickness. Do the staff who are present have the right skills to support one another? And also we need to think about our workload and how that impacts on us. We might have a lot of competing demands. We need to know whether we're having the appropriate supervision. Do we have time to reflect, have some time to think about the impact of our work, and do I have the appropriate training? So all of these things can impact on how we feel about ourselves and impact on our mental health. And some of these things might be more or less within our control to manage. All of us have jobs that are related to caring, and often helping people who have suffered in some way, who are still suffering, whether that's physical, emotional, or psychological. It can be it can be hard to step into that distress and look after that person. And it's also hard to never be impacted by the work that we do. The cost of caring is an occupational hazard. Our training can help us here, but even that doesn't completely insulate us at times from feeling the impact of the work that we do. And this is a really nice quote. So the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet.
So what is trauma? When we are trying to understand what secondary trauma is, I think it's important that we firstly define what trauma is. Here is a clear definition. Individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Key things are something has happened outside of usual experience, usually threatening to our life. It threatens our emotional integrity and has those lasting effects upon the person. Key to note that not everyone will develop long-lasting effects, for example, PTSD, which some of you might be familiar with. This stands for post-traumatic stress disorder, and can occur after someone has experienced a trauma. The majority of people will recover without formal help. However, many do benefit from formal help, and we will explain this a little bit more. Trauma can occur directly to the person or indirectly where someone is exposed to trauma secondhand. So secondhand trauma is what we will be focusing on today. So how common is trauma? Whatever health or social care settings we are working in, we will be coming into contact with people who have experienced trauma and adversity. Therefore, our roles are trauma exposed, and we will be hearing and witnessing people's distress and suffering. This will potentially have an impact on us. Note how common trauma is, affecting people presenting in all health and care settings. Know that there are links between adverse childhood experiences, or ACEs, and a range of health conditions. So adverse childhood experiences are stressful events occurring in childhood, including domestic violence, parental abandonment through separation or divorce, a parent with mental health condition, being the victim of abuse, whether that's physical, sexual, and or emotional, being the victim of neglect, again, whether that's physical or emotional, where a member of the household might be in prison, growing up in a household in which there are adults experiencing alcohol and drug use problems. Long-term health condition associated with adverse childhood experiences might include chronic lung and heart disease, liver disease, autoimmune diseases, sexually transmitted infections, and mental health problems. We know that marginalized populations are more at risk of experiencing adverse childhood experiences. So whether that's people living in low-income communities, Black, Hispanic, or racial minorities, lesbian, gay, bisexual, and transgender individuals, individuals with disabilities, women, and girls. Other events that might traumatize people can include the examples as listed on the slide: abuse, assaults, terrorist attacks, and so on. This can all result in traumatic response. The Wellbeing Line uses a term adverse event to identify distressing events. This might not be what is considered a serious incident, or it might be a different process to be followed. But we also aim to move away from talking about only traumatic events, because the language is important. The adverse events are deeply distressing events with the potential of individuals to be traumatized, but that is not even inevitable. Often the event has happened suddenly, or is something out of the ordinary, or rare for the particular team or an individual to be dealing with. We know that reality is that there are natural responses to such events and longer-term traumatic responses that might happen, and we'll be talking about those. So what else do we know about adverse events? Adverse events at work occur fairly frequently, particularly in health and social care settings. Initially, these events might be followed by a sense of shock and disbelief, and that can gradually subside over a few days. So people might not struggle immediately after the event, but maybe weeks, months, or even years down the line. Subsequently, people will experience a range of emotions and reactions, and these will be very individual differences between people. We also know that 2 out of 3 people will not actually experience any difficulties, and these will be resolved after a few weeks without treatment. In fact, most people who experience an adverse event do not go on to develop a long-term mental health difficulty or traumatic responses. But we also understand that there is indirect trauma. So how does this help us to understand secondary trauma, and what is this? So secondary trauma is an umbrella term for both secondary traumatic stress and vicarious trauma. Secondary trauma is an indirect experience or exposure to a traumatic event. So for example, hearing a first-hand account of the event given by a survivor can be very traumatic and emotionally challenging experience for the person receiving it. Healthcare providers and mental health workers are more frequently exposed to traumatic events in this manner. To provide patients with appropriate medical and psychiatric care following a traumatic event, it is necessary to understand exactly what the patient has experienced, both physically and emotionally. There is a general assumption amongst both that general population and other caregivers that mental health workers should expect to hear these vivid recollections of traumatic events and therefore be prepared for them. Coupled with a general lack of awareness of the potential psychological impact of that recollections, can have impact on those who hear them. Secondary trauma is currently a woefully understudied phenomenon, and additionally, it is increasingly thought of by professionals as an original or primary trauma, as it can be so invasive. When we think about secondary traumatic stress, this describes the set of symptoms that a person can experience after engaging with somebody who has experienced trauma. Another way of informally describing or thinking about this is secondhand PTSD. This is not an actual diagnostic of PTSD though. Vicarious trauma overlaps with secondary traumatic stress to a large degree, with a few subtle differences, mainly greater focus on change in beliefs in a clinician. It focuses more on the clinician's inner experience being negatively transformed through empathic engagement with patient traumatic material. This can lead to a profound shift in your worldview. For example, a domestic violence worker may stop believing that relationships can be healthy. A child abuse investigator may lose trust in anyone who approached their child. So we move into beliefs like people are bad, I'm not safe. This can be harder to spot, and it tends to take place over time. Who can develop secondary trauma? Health and social care professionals are trauma exposed. That is, we can be particularly likely to have professional contact with people who have experienced trauma of some kind. It is important to say here that everyone is different. 2 people in the same team can have similar contact with the same patient, and one will be affected by the secondary trauma and the other won't. Vulnerabilities such as previous experience of trauma and current level of non-traumatic stress can all make a difference. It is important that there is a buffer in between us and the people we work with. If there are similarities there, then it can be more difficult to hold that buffer. For example, if a member of staff had lost someone they know in an accident and then at some point had to look after a patient after a road traffic accident and heard details of that particular accident, they might find it more difficult to hold that buffer and might find themselves struggling, even years after. So secondary trauma isn't always immediate and can occur a long time after the events that triggered it. There are some of the natural responses to a difficult or traumatic event, and these can also be present when experienced trauma indirectly through hearing about or seeing the effect of trauma. Responses to difficult events or circumstances will again vary depending upon the individual, their past experiences, the circumstances, and of course the support people have around them. If we consider some of these responses to a singular event initially, there might be a sense of shock and disbelief, as we already said, which might gradually subside over time. There is no right or wrong way to feel or to cope in this kind of situations. It is important to remember that people respond in varying ways, but most people who have experienced a difficult event will not develop any long-term difficulties. So let's look at some of these natural responses to trauma. We want to acknowledge that there are some thoughts that might be kind of common. I should be coping better. There is something wrong with me. Others will judge me badly if I share how I feel. I should have done or not done something. So we can see there is lots of different thoughts that come in. When it comes to emotions, these can be, again, very different, and they are all valid. Whether that's sense of helplessness, worry, or fear, anger, relief, shame, or embarrassment. When we look at the behaviors, again, these will be varying from person to person. There might be a loss of motivation, real difficulty to concentrate, eating more or less, lack of interest in usual activities. We might withdraw from social activities and social life, but also we might not want to be alone. And when it comes to physical sensations, how does this actually is experienced in our body? We might struggle with sleep. We might feel extremely tired. There might be changes in our appetite and digestive problems. We might feel numb, but also in aches or pains. And quite often people will report muscle tension, dizziness, restlessness. So we can see that there is a lot of different responses to trauma. And this might be experienced by different people differently. What does long-term impact of trauma looks like? Again, depending on the nature and the circumstances of the trauma and whether this is a singular event or has been more complex or ongoing, people's individual responses will vary. For some people, there can be longer lasting impact of the trauma, and this can impact on their mental health as well as physical health. So quite often we can see the longer term impact of trauma as flashbacks or intrusive images, as we said, poor sleep, nightmares, vivid dreams, becoming quiet and withdrawn. We might be, again, feeling very irritable and angry, that hypervigilance might increase. We might feel quite numb at times, and there might be increased sensitivity to risk. What's really important in those long-term signs is also diminished sense of hope for the future, kind of increased anxiety, increase in harmful behavior patterns, and as we said, impact on physical health. Long-term impact of trauma in the work context. What does this look like at work? Long-term, we might need to look out for different changes in our own thoughts and beliefs about ourselves, others, and the world. We can see when we think about the long-term impact, it focuses more on the clinician's inner experience being negatively transformed through empathic engagement with patient traumatic material. This can lead to profound shift in worldview, as we said. So lingering feelings of anger, rage, sadness about patients' victimization. Difficulty in maintaining professional boundaries with the client. So when we struggle with those, loss of hope, pessimism, cynicism, difficulty listening to further trauma material, numbing, distancing, and preoccupation with thoughts about the patient or client. These can be harder to spot as it tends to take place over time, and we can really see how people might be struggling internally. However, with the right support and connection with other people, we can experience post-traumatic growth. When we are exposed to traumatic events, whether that's directly or indirectly, this can unintentionally yield changes in understanding oneself, others, and the world. And it's really important to recognize those. It's really important to recognize those signs we've talked about and put the right support in so we can connect with others and hopefully recover and achieve post-traumatic growth.
So let's think about how we start to develop some self-compassion to these feelings that we might have if we've been experienced to trauma, either directly through our work or indirectly through the things that we've heard from our clients. And recognizing what's going on is a helpful place to start. And it can help deepen our understanding of our experiences and our emotions. So if you've been to previous webinars or sessions delivered by the Wellbeing Line, you'll be familiar with the three circles model, but we'll just briefly recap. So this was a model that was devised by Paul Gilbert, and it comes from neuroscience and evolutionary psychology. It suggests that we have three main systems that we use to regulate our emotions and our behaviours. They each have a unique job to do. So briefly, our threat system, which is the red circle down the bottom, is designed to protect us and defend us from harm. It's often known as the fight or flight, and it involves emotions like anger, anxiety, and disgust, and the hormones cortisol and adrenaline. Our drive system, or the blue circle, helps us achieve our goals. So it's associated with attainment. So to do the things to meet our basic needs for food and shelter, for example. It's associated with the emotions, excitement and joy, but also that sense of achievement, motivation. And it has a dopamine response, which is the neurotransmitter that gives us some nice positive feedback when we've done something that either gives us that sense of achievement or brings us joy. Our soothing system, or the green system, is designed to offer balance to the three systems and gives us the chance to recuperate or regain the energy we've used in the other two systems, which are much higher energy systems. It's linked to feelings of contentment, connection, and safeness. So it's associated with the hormone oxytocin, which is the love hormone. So it gives us a real sense of connection and safeness, which is rather than safety seeking. Each system has its own unique job to do, but they're all needed to be able to work together to be in balance and create a compassionate mind. Developing our compassionate mind is not about getting rid of the emotions, but learning to understand and regulate them in a helpful way. Self-compassion is about recognizing that we're responding in this way and doing something that helps us in the moment without judgment. So when something activates our threat system at work, so for example, hearing some emotive information from a client or colleague, we can notice what it feels like in our body and that our brains are just trying to work to keep us safe. So the fight or flight, to move us to action. We might then go into our drive system to alleviate this threat, for example, getting busy in doing or sorting out risk, supporting the client. But these are both high energy systems, and bouncing between the two can lead us to moving into more threat-based drive. This is where we get less of the nice dopamine response from the drive system, and we might become more reactive to situations, and ultimately we might feel more exhausted. We need to recognize how we then slow down and activate our soothing system. This helps bring on the new part of our brain, so the prefrontal cortex, which can help restore some of the balance to our systems and help regulate our responses. If someone is struggling with secondary trauma, vicarious trauma, they're often in fight or flight, so the red threat system. We need to be able to recognize this in ourselves and find ways to support ourselves either practically through our blue circle or by activating our own soothing response through our green circle. So how do we develop our compassionate mind? This is about recognizing when our circles are out of balance and bringing some empathy and understanding to this, and then ultimately doing something to redress the balance. We know that compassion for ourselves is empathy plus action. So recognizing that I might be struggling and then doing something about it. Compassion is about slowing down, processing, reflecting, and taking time to understand ourselves and other people. So when I'm developing my compassionate mind, I'm recognizing my own distress. I'm bringing awareness to my responses. I'm understanding that my circles might be out of alignment. I'm finding ways that I can slow down and soothe myself. I'm recognizing what might have triggered those responses. And then ultimately, I might be connecting with others around me. So my colleagues, people outside of work, maybe my line manager. We can start to recognize our distress by thinking about our early warning signs that are relevant for us. So how does stress show up for you? So what am I noticing? Am I noticing any of those signs that Martina mentioned a little bit earlier in the webinar? So am I feeling more irritable, anxious, overwhelmed? Or am I feeling slightly more disconnected from work? Is it having an impact on my behaviours? So for example, my sleep, am I feeling more tired? Is it affecting my appetite? Am I withdrawing or avoiding things? So I'm noticing my responses. I'm then thinking about how I can respond to myself with care and kindness. So what would I say to a friend right now? What would I say to another colleague right now if they were telling me this? And what do I need to do right in this moment? And then we're moving to compassionate action. So how can I be compassionate towards myself? How can I give myself the comfort that I need in that moment? What does that look like for me? And we can ask ourselves and think about that, in terms of maybe I need to speak to myself more kindly. Maybe I need to give myself a bit of grace. Maybe I need to take some time. But these are all quite simple things. It might be going and speaking to a colleague and having a sort of a mini debrief about what has just happened, just to give you that space to reflect and think and move you into that more of that green response. So in practice, what might this look like? We're going to talk a bit about by keeping or reinstalling that protective buffer. So keeping a separation between work and home life is important for our well-being and avoiding stress and burnout. However, this is particularly important in preventing or when we're experiencing secondary trauma. As we spoke earlier, secondary trauma involves that barrier between us and the people we work with and become a bit blurry, or it's not as robust as it was. It's therefore helpful for us to work on doing things that will reinstall this boundary. So many people find that creating a ritual to be helpful that sort of starts this process. This is a set pattern of things that you do to signal a shift from the workplace with all the associated thoughts, behaviours and feelings to the home place. These days, these boundaries have become more blurred due to increased working from home, which we know has its benefits in lots of ways. And often people feel that there's an always on culture when we've got emails or messages pinging onto our phone. And this has been with the rise of technology. So it's been particularly important that we re-establish these boundaries, both to help prevent secondary trauma and also if we find that we are struggling with secondary trauma. You may want to tweak these things if you're aware that you may be working with a patient or situation where there is a higher risk of secondary trauma. For example, if I'm aware that a certain day or week is likely to bring more exposure to distressing material, then I would plan additional self-care things to do in my evenings or in my weekends. So, for example, I might do that to have things to look forward to in those times. Or when I'm in a work situation, I might plan in check-in conversations with a colleague to ensure there's time for the green circle to be developed. Talking to trusted people is also important. Can you talk to your line manager, a colleague? Can you talk to someone in an employee assistance program, a counsellor? We can talk in a way that doesn't break confidentiality by sharing just the impact on us and not sharing the details about the person. I also can't emphasize the basics enough. Working at getting good sleep is particularly important, as it ensuring you keep your usual routines around eating and hydrating yourself. These are often some of the first things to go when we're feeling stressed or distressed. So how do we look after each other? So we can be more aware of the signs and signals that our colleagues might be struggling. Do we notice something has changed? So might they be acting out of character? Might they be unusually quiet or perhaps a bit more irritable or argumentative? Often we can offer to speak with them and find someone that they trust so they can have these conversations. We might want to have more regular check-ins with them, particularly if they're working from home. When we think about how we look after ourselves and how we offer compassion, it flows three ways. So this part is about how we offer compassion to others, how we recognize when someone else is struggling. And because compassion is empathy plus action, we are recognizing their distress and then we're wanting to do something about it.
When to seek help. You might need help if you have been experiencing these natural responses to difficult events, and if there is no sign of them improving. People might be quite unsure when to seek help, and there is sometimes culture of get on with it, particularly if other colleagues don't seem to be struggling in the same way. Just a reminder, if there are vivid images related to what you've heard, if you're easily startled and agitated, difficulties with sleep, overwhelming emotions, tiredness, memory difficulties, and so on, please do reach out. If you notice a change in the way you approach your work, and if you notice that this is impacting on your ability to do your job, please reach out. Next question is, where do we seek help? It is not a weakness to ask for help, and as helpers, we need to look after ourselves first before we can look after others. Self-care is not selfish, and it is very much essential in being able to support others. So here is a list of things where we can seek support. Please reach out to your GP and or other services that are there to support staff within your organization. Whether that's employee assistance program, NHS talking therapies, potentially reach out to occupational health and human resources, and of course, the Wellbeing Line. In conclusion, secondary trauma is an occupational hazard of being in helping professions. Not everybody experiences it, but we do need to know what to look out for. It is important that we are aware of these signs and symptoms and take actions when we notice them. There are key things that we can do to help look after ourselves in this area. There are also other things that our organizations can be doing to help protect staff. And if you can identify different ways of working, then it could be helpful to consider these or feed them back to your line managers. It is important to take action if you find yourself struggling, particularly if that is for more than a few weeks, and definitely if you are having suicidal thoughts. In these cases, please speak to your GP. We hope that this has been helpful today. And as we offered these services, please think about the Wellbeing Line as we end the session. You can contact us if you are struggling, and we can offer you a space to think about the impact it's having on you and plan appropriate support. There is lots of ways we can support you as well as your teams, which is free and confidential. Please reach out to us via phone or email to access our support. The Wellbeing Line works across the ICS and provides free, confidential help to health and social care staff across Gloucestershire. So we therefore have a broad offer which includes support to all levels, as we said, individual, team support, support to team leads themselves, and support for organization as a whole. The fact that we are an independent service sitting outside of services such as HR or occupational health provides a level of safeness and confidentiality that is appreciated by staff who use our service. So thank you very much for watching this webinar, and our contact details are here. Thank you.